Table of Contents. Introduction. 1. Headache. 1.1 Migraine. 1.2 Tension headache. 1.3 Sinusitis-induced headache. 2. Neck pain. 2.1 Cervical spondylosis. 3. Shoulder pain. 3.1 Frozen shoulder. 4. Elbow pain. 4.1 Tennis elbow. 5. Wrist pain. 5.1 Carpal tunnel syndrome. 6. Abdominal pain. 6.1 Peptic ulcer. 7. Low back pain. 7.1 Sciatica. 8. Knee joint pain. 8.1 Osteoarthritis. 8.2 Rheumatoid arthritis. 9. Heel and sole pain. 9.1 Plantar fasciitis. 9.2 Calcaneal spur. 10. Lifestyle interventions. Glossary. References. Acknowledgement. Introduction. Tension headache. Cervical spondylosis Carpal tunnel syndrome. Sciatica Rheumatoid arthritis. Migraine. Sinus headache. Frozen shoulder. Tennis elbow. Peptic ulcer. Osteoarthritis. Plantar fasciitis. Calcaneal spur pain is the phenomenal feature that every living being is haunted from. Pain can range from a minimal level to extensive variants. Any modality that can handle or manage pain is highly acclaimed. When contemporary medical sciences tries to manage pain as a mere symptom concentrating on its effect and nullifying it, Ayurveda and its therapies stand higher to remove the root cause of it. This publication is intended to provide a general information to the public about most common painful conditions and the scope of Ayurveda in managing them. Ranging from head to toe, most common conditions of pain are enlisted along with its management through Ayurveda and supporting evidence. Also, commonly used therapies for managing painful conditions will create awareness about various Ayurveda therapies. This will serve as a handbook to understand the most common painful conditions, scope of Ayurveda in managing them. Refer Glossary for Ayurveda terminologies. 1. Headache. 1.1 Migraine headache. 1. Migraine is characterized by severe head pain. Associated with nausea, vomiting, aura, sensitivity to light, sound or smells. It can be pulsating and commonly one-sided. It is aggravated with movement and physical activity. One episode can last from 4 to 72 hours. It can be triggered by many factors, like stress, loud noises, hormonal changes, etc. Scope of Ayurveda. 2. Migraine is a condition that Ayurveda can help with its internal medications and external therapies along with purificatory panchakarma treatments. Nausea, Shirodhara, Shiralipa are proved to be very beneficial in treatment of migraine. Certain Ayurvedic internal medications 3 like Narakila Lavana, Sudhasekar Rasa, Cytopalati Churna, Rasona Vaitai and Godantai Mishran along with regulated diet and lifestyle modifications such as minimum 8-hour sleep, 30 to 60-minute morning or evening walk or yoga and abstention from smoking and drinking is helpful in management of migraine. Shirodhara. 1.2 Tension headache. 1. It is one of the most common types of a headache. Excessive exertion, contribute to the tension headache. Stress, impaired. Commonly seen in the female population. Sleep. Occurs in the whole head, but may begin in the back of the head or above the eyebrows. Feeling of band-like sensation which encircles skull, and muscle tension in the neck. Unlike a migraine, tension headache is not associated with nausea and vomiting. Scope of Ayurveda. It can be very easily managed in Ayurveda with various time-tested therapies including panchakarma along with internal medicines prescribed after proper diagnosis. Shirodhara, Shiro Abhyanga, Shirapaku, Talam, Shiralipa are so some common treatments prove to be very beneficial in managing such conditions. 2 Use of anxiolytic medicinal plants like ashwagandha, Withania somnifera, jatamansi, Nardosticus jatamansi, Tagar, Valeriana wallichii, 5, and Brahmi, Bacopa monnieri, are very effective in reducing stress and anxiety. Sharapiku. 1.3 Sinusitis-induced headache 1. It is a condition characterized by inflammation of mucosal lining of paranasal sinuses lasting less than 4 weeks. Nasal congestion, running nose, facial pain, difficulty in smell sensation and sneezing are the most common symptoms associated with sinusitis. Sometimes, it is also associated with fever and headache in sinus areas. Forehead. Surrounding eye. Cheek. Scope of Ayurveda. Shodhana or nasal air hind therapy under Panchakarma is a form of nasal instillation of liquid medicine which reduces and clears the nasal mucosa. Along with this, internal administration of medicine is helpful in reducing the symptoms of sinusitis. 2 Medicated lepa in the affected area also helpful in managing this condition. Certain internal medications like Dasamola decoction, Chitruk haritaki are found to be beneficial in management of sinusitis. 2. Neck pain. 2.1 Cervical spondylosis 1. It is a degenerative disease of the disc and joints of the cervical region. It causes the narrowing of the spinal foramen along with formation of osteophytes. It causes severe pain in the neck region radiating to shoulder and to one or both hands. The pain is neuralgic and causes ligament instability. It is found common in males compared to females. Scope of Ayurveda. Ayurveda has an upper hand in managing this condition. Internal medications like Bala, Sida cordiafolia, Prazarini, Pediria foetida, Gugulu, Comifera mucul, Dasamola etc. are very helpful in managing this condition. 23. Panchakarma therapies like Abhyanga, oil massage, Swedana, Griva busti brahmananasia, Jambira pinda Swedana are proved to be very beneficial in reducing pain and degenerative changes. 3. Shoulder pain. 3.1 Frozen shoulder 1. Connective tissue surrounding the glenohumeral joint of the shoulder becomes inflamed and stiff. There is the restricted motion of shoulder joint and progressive loss of both active and passive range of motion. Causes chronic pain. Pain is usually constant, worse at night, and with cold weather. Scope of Ayurveda 2. It is related as apabahuka or avabahuka in Ayurveda. It can be successfully managed through samshamana therapy. Panchakarma procedures like Abhyanga, Jambira pinda sweta, Griva busti, Nasia 2, and Busti karma are very helpful in managing this condition. 4.1 Tennis elbow 1. 4. Elbow pain. In this condition there is pain is on the outer part of the elbow. Point tenderness over the lateral epicondyle, a prominent part of the bone on the outside of the elbow. Movements of the wrist, especially wrist extension and lifting movements, cause pain. Patient may feel pain when shaking hands or torquing a doorknob, and not being able to hold relatively heavy items in the hand. Pain may radiate from the outside of the elbow to the forearm and wrist. Scope of Ayurveda. Combination of internal medication along with Ayurveda para-surgical method. Agnikarma 2 is helpful in managing this condition. Procedures like Parashika, Upanaha, Bandhana and Lepana karma reduces pain and inflammation. 5. Wrist pain. 5.1 Carpal tunnel syndrome 1. This disease is occurring due to the compression of the median nerve, the nerve that supplies the hand and fingers, is compressed at carpal tunnel in the wrist. This causes slow or severe, exaggerated, nerve conduction resulting in severe pain, tingling, burning or itching sensation, paresthesias, numbness and weakness in affected hand. Scope of Ayurveda. Rasna, Plukia lanceolata, Gugulu, Comifera mucul, Dasamola-based formulations are proved to be beneficial too. Abhyanga, Sthanika swedana, Sthanikthara and Upanaha, are also proved to be very beneficial in this condition. 3.6. Abdominal pain. 6.1 Peptic ulcer 1. It is a very common manifestation. Abdominal pain may occur due to ulcer in stomach, gastric ulcer, duodenum, duodenal ulcer, esophagus, esophageal ulcer. It can be caused due to infection of the stomach by Helicobacter pylori and chronic use of NSAIDs painkillers, nonsteroidal anti-inflammatory drugs. Main clinical feature is upper abdominal pain, which can be dull, sharp, or burning. May be associated with features like acid reflux or heartburn. If not treated early, may lead to complications like bleeding, perforation of stomach/duodenum. Scope of Ayurveda. This condition can be very well managed through Ayurveda medicine and dietetics. In acute conditions, Amlapitta, Sadio Vamana procedure is found to be very beneficial. Drugs like Shatavari 2, Asparagus racemosus wild, Yastamatus, Glycyrrhiza glabra, Kushmanda 3, Benincasa hispida, Thatri lauha 3, Avapadikar churna 1 are effective in managing this condition. 7. Low back pain. 7.1 Sciatica 1. Sciatica is a common and often disabling low back disorder in the working-age population. Low back pain is a global health problem affecting all age groups. Sciatica usually a clinical manifestation of lumbar disc herniation, protrusion of shock-absorbing disc between the vertebral column. Sciatic pain or lumbar radicular pain. The typical symptom of sciatica is defined as pain radiating from the back down to the leg, usually caused by compression or irritation of one of the lumbosacral nerve roots. Scope of Ayurveda. Medicinal plants like Nirgundi, Vitex nigundo, Parihata 3, Nictans arbortristis lin, are found to be extremely beneficial in the management of sciatica. Panchakarma procedures like Busti Karma, therapeutic enema, Patrapinda Sweta, and Kati Busti are found to be effective modalities. 1. Therapies like Rakta Mokshan, therapeutic bloodletting, and Jalukvakaran, therapeutic leech application, are found to be beneficial in some conditions. Kati Busti. 8. Knee pain. Arthritis. Even though there are many forms of arthritis, most common types of arthritis observed are osteoarthritis and rheumatoid arthritis. Even post-fever common in present days. Chikungunya. Arthritis is. 8.1 Osteoarthritis 1. Osteoarthritis, OA, is a chronic degenerative disorder of multifactorial etiology characterized by loss of articular cartilage, hypertrophy of bone at the margins. Typical clinical symptoms are pain, particularly after prolonged activity on weight-bearing joints, whereas stiffness is experienced after long time of inactivity. It is also known as degenerative arthritis, which commonly affects the hands, feet, spine and large weight-bearing joints, such as the hips and knees. Scope of Ayurveda 2.3. Internal administration of regenerative medications, Rasayana. Panchakarma therapies like Abhyanga, Swedana Tiktik Shira Busti, Kalkapatra Bandhana and Janu Busti are proved to be very beneficial. Healthy knee joint. Osteoarthritis. 8.2 Rheumatoid arthritis 1. It is a chronic multisystem disease, with characteristic features of persistent inflammatory synovitis that usually involve peripheral joints in symmetric distribution. Persistent synovial inflammation often causes cartilage damage and bone erosions that badly disturbs joint integrity, as an outcome of which 1/3 of patients suffer from working disability. Also, other classical symptoms include positive Ra factor and raised erythrocyte sedimentation ratio, ESR. As per Ayurveda diagnosis, it is different from osteoarthritis with its inflammatory changes, internal digestive changes, feverishness etc. Scope of Ayurveda. Ayurveda formulations with Agnidipana, Amapakan and anti-inflammatory properties are effective in managing this condition. 2-3. Baluka Sweta, Sarvangadhara, Lepa, Bandhana, Kshara Busti and Virakana are found to be very effective. Post-fever arthritis show similar clinical symptoms and are managed effectively in Ayurveda. 5. Rus, ricinus communis. 9. Heel and foot pain. 9.1 Plantar fasciitis 1. It is one of the common cause of heel pain. It is characterized by pain in heel and bottom of the feet. The plantar fascia is the flat band of ligament that connects heel bone to toes. Inflammation of plantar fascia ligament is called as plantar fasciitis. It is caused by repetitive strain injury to the ligament of the sole of the foot. Pain is typically sharp, often unilateral, usually most severe with the first steps of the day or following a period of rest. Improvement of symptoms is usually seen with continued walking. Pain is also frequently brought on by bending the foot and toes up towards the shin. Risk factors include overuse such as long periods of standing, heavy exercise, and obesity. Hulbank. Plantar fasciitis. Plantar fascia. Ligament. Scope of Ayurveda 2. Gugulu, Comifera mukul, Nirgundi, Vitex nigundo, and Dasamola etc. are useful for internal administration. Raktamakshana and Panchakarma procedures like Parashika, Pralipa, Upanaha are found to be beneficial. 9.2 Calcaneal spur 1. Calcaneum is the largest bone in the foot. Spur denotes a bony outgrowth from the heel bone, calcaneal tuberosity. It occurs due to constant stress. Calcium deposits build up on the bottom of the heel bone. People who are obese, have flat feet, or who often wear high-heeled shoes are most susceptible to heel spurs. Pain in the region surrounding the spur, which typically increases in intensity after prolonged periods of rest. Pain to be more severe when waking up in the morning. Difficulty in bearing weight on the afflicted heel. Walking, running may exacerbate the pain. Scope of Ayurveda. Stretching exercises and yoga. Shoes with soft, cushioned soles. Ishtika Sweta, medicated steam using brick, lepa, parashika, agnikarma and shringa application is helpful in this condition. 10. Lifestyle interventions. The food articles mentioned in Ayurveda are beneficial in managing painful conditions. The sweet, sour and salty tastes decrease vata by bringing moisture, bulk and warmth to the body, which are opposite qualities to those of Vata. 1. Specific lifestyle mentioned in Ayurveda like Dinacharya, Ritakarya should be followed after a proper advice from the nearest Ayurveda Swasthavrita expert. Obese persons are more prone to suffer from various painful conditions, so a control in body weight is always necessary for preventing painful conditions. 2 Factors that influence pain are smoking, alcohol and sleep problems. Following a lifestyle that suits one's own nature, prakriti, avoiding vata increasing activities will be very helpful in common painful conditions. 3, 4. Role of mind is very important in the management of pain. 5-7 Without proper mental health, anxiety and stress can aggravate painful conditions. Right thoughts and always a hope to come out of the pain by realizing oneself is the concept of Ayurveda in dealing with pain mentally. 8. Glossary. Chapter 1. Headache. 1.1 Migraine. A. Panchakarma, 5 major procedures in Ayurveda that is useful in eliminating the excessive deposits of toxins from body through various natural channels. It includes Vamana, therapeutic-induced vomiting, Virekana, therapeutic-induced purging, Nausea, nasal administration of medicated liquids, 2 kinds of Basti, therapeutic intrarectal administration of medicated liquids. B. Nausea, one among the treatments of Panchakarma. Consists of oil massage, followed by herbal steam inhalation to chest, shoulders and face, followed with installation of medicated liquids preferably medicated oil. C. Sharadhara, a continuous stream of liquid preferably herbal decoction or oil poured at forehead from a specific height in a specific rhythm. D. Shiralipa, medicated herbal paste applied in head. 1.2 Tension headache. A. Sharadhara, mentioned in glossary of chapter 1.1, c. B. Shiro Abhyanga, massage of head with specified herbal oils. C. Sharapaku, medicated herbal oil tampon placed in head. D. Talam, herbal paste made out of mixing herbal powder and oil applied onto the vertex maintained for a specific period. E. Shiralipa, mentioned in glossary of chapter 1.1, d. 1.3 sinusitis-induced headache. A. Shodhana, one among the treatments of Panchakarma. Consists of oil massage, followed by herbal steam inhalation to chest, shoulders and face, followed with installation of medicated liquids specifically with expectorant liquids. Chapter 2 Neck pain. 2.1 Cervical spondylosis. A. Abhyanga, therapeutic herbal massage carried out in specific steps with medicated herbal oils for specific period of time. B. Swedana, therapeutic perspiration-inducing herb-based steams. C. Griva Busti, medicated oil column bordered with black gram paste behind the neck in cervical region, where medicated herbal oil is maintained at specific temperature for specific period of time. D. Jambara Pinda Sweta, a bolus-based massage consisting of mainly lemons with medicated powders which are massaged along with oil to induce perspiration. E. Brahmana, one among the treatments of Panchakarma. Consists of oil massage, followed by herbal steam inhalation to chest, shoulders and face, followed with installation of medicated liquids specifically with nourishing liquids. Chapter 3 Shoulder pain. 3.1 Frozen shoulder. A. Abhyanga, refer glossary of chapter 2.1, a. B. Jambira Pinda Swedana, refer glossary of chapter 2.1, d. C. Griva Vasti, refer glossary of chapter 2.1, c. D. Sneha, one among the treatments of Panchakarma. Consists of oil massage, followed by herbal steam inhalation to chest, shoulders and face, followed with installation of medicated liquids specifically with lipids. E. Busti Karma, one among the major Panchakarma treatment where a cyclic method of decoction and oil-based enemas are adopted for specific duration of days. Chapter 4 Elbow pain. 4.1 Tennis elbow. A. Agnikarma, therapeutic cauterization using special instrument in a specific pattern on the affected area. B. Parashek, therapeutic pouring of medicated liquids, decoction, oil etc. C. Upanaha, medicated poultices prepared from herbs and oils tied at a specific region for around 12 hours. D. Bandhana, bandaging of herbal medicated paste at specific region for specific period of time. E. Lepana, local application of medicated paste until it dries off. Chapter 5 Wrist pain. 5.1 Carpal tunnel syndrome. A. Abhyanga, refer glossary of chapter 2.1, a. B. Swedana, refer glossary of chapter 2.1, b. C. Sthanikadhara, continuous stream of medicated liquid poured at a localized area lukewarm for a specific duration. D. Upanaha, refer glossary of chapter 4.1, c. Chapter 6 Abdominal pain. 6.1 Peptic ulcer. A. Sadio Vamana, a therapeutic process of induced controlled vomiting in a minimal manner. Chapter 7 Low backache. 7.1 Sciatica. A. Matrabusti, a therapeutic enema using medicated lipids carried out for a specific duration. B. Busti Karma, refer glossary of chapter 3.1, e. C. Kati Busti, medicated oil column bordered with black gram paste behind the low back in lumbar and sacral region, where oil is maintained at specific temperature for specific period of time. D. Patrapinda Sweta, a bolus-based massage consisting of mainly leaves which are pain-alleviating in nature massaged along with oil to induce perspiration. E. Jalukavakarana, therapeutic bloodletting therapy using non-poisonous aquatic leeches, Hirudo medicinalis. F. Raktamokshan, therapeutic bloodletting process commonly carried out with needle or scalp vein set from the veins. Chapter 8 Knee joint pain. 8.1 Osteoarthritis. A. Abhyanga, refer glossary of chapter 2.1, a. B. Swedana, refer glossary of chapter 2.1, b. C. Upanaha, refer glossary of chapter 4.1, c. D. Pinda Sweta, bolus-based massage using various herbal powders for therapeutic outcomes of steaming. E. Janu Busti, medicated oil column bordered with black gram paste above the knee joint, where oil is maintained at specific temperature for specific period of time. F. Tiktik Shira Busti, cyclic method of decoction based on milk and bitter herbs and oil-based enemas are adopted for specific duration of days. G. Kalkapatra Bandhana, application of fresh leaves paste along with bandaging. 8.2 Rheumatoid arthritis. A. Baluka Sweta, external bolus massage using sand. B. Sarvangadhara, medicated liquid pouring all over body with a specific temperature for mentioned duration. C. Lepana, refer glossary of chapter 4.1, e. Bandhana, refer glossary of chapter 4.1, d. D. Upanaha, refer glossary of chapter 4.1, c. E. Virekana, process of therapeutic purgation. Chapter 9. Heel and soles pain. 9.1 Plantar fasciitis. A. Parashika, refer glossary of chapter 4.1, b. A. Pralipa, refer glossary of chapter 4.1, e. Lepana. A. Upanaha, refer glossary of chapter 4.1, c. B. Raktamokshan, refer glossary of chapter 7.1, f. 9.2 Calcaneal spur. A. Ishtika Sweta, therapeutic sweat-inducing procedure through use of bricks and medicated decoctions. B. Stanika Lepa, refer glossary of chapter 4.1, e. Lepana. C. Agnikarma, refer glossary of chapter 4.1, a. D. Shringa application, therapeutic bloodletting process carried with the help of animal horn. Nowadays it is carried out using various vacuum pumps.